When I learned of this statistic, I was quite intrigued by it because it just doesn't make sense that 40% of the population are not aware of even what one symptom of stroke may be. So in thinking of a way to educate the public, various organizations have come up with mnemonics, and one of them is, as it's shown here, F.A.S.T, which stands for face, so you ask the person to smile, and if they have an abnormal smile which is asymmetric, that's a sign of a stroke. Arm, which is where you ask the patient to raise your arms, and if they're unable to do so and unable to keep their arm up, such that one drops, that's a sign of a stroke. Speech is just asking the person to repeat a simple sentence or tell you a sentence, and if their speech is not clear, that should alert you immediately that there likely is something wrong. Most commonly is going to be a stroke. Time is the critical component, because if you have any of these aforementioned symptoms, the sooner you get to health care, the better outcome is going to be. So know your blood pressure and have it checked routinely, at least annually. I would recommend doing it more frequently than that. Find out if you have a condition known as atrial fibrillation. If you smoke, of course, stop. If you drink alcohol, do so in moderation. Is your cholesterol elevated or not? And if it's elevated, treat it. If you're diabetic, follow the recommendations of the provider, but make sure that you're seeing someone that's aggressive at helping you to manage that condition. Exercise is probably the most important thing. It's better than managing blood pressure, but it goes along with controlling your sugar and controlling your blood pressure. When you exercise, you also lose weight. You don't need to add any salt to your diet in the United States. So in essence, the sooner you get to the hospital and the sooner we deploy a therapy if it's applicable, the smaller the area that's going to be damaged.
The brain is an organ that's roughly about that big. It consists of 100 billion neurons packed into this little space. It's about 2% of your body weight. And these 100 billion neurons are connected to each other in special ways, and they're connected to your body in special ways. And in order to do all of this stuff, it needs a whole lot of blood. All right? I said it accounts for about 2% of your body weight, but it takes up 20% of your heart's output. So every beat that your heart makes, 20% of that blood goes up to the brain to sustain these structures. And the way that that blood gets to where it's going is through this very complex network of blood vessels. So this is a picture of an angiogram where we're looking face on at a patient, and you can see the carotid artery, this is that middle cerebral artery, and this is that anterior cerebral artery. This is what it looks like when you have a stroke, an embolic or a thrombotic stroke. You basically form a clot inside the blood vessel, and nothing gets by it. And in this case, this person is especially bad off because not only have you lost one blood vessel, you've lost both of them by knocking out the main trunk. And especially in this situation, time is of the essence. Good news is we now have the technology and the skills to take this and turn it back into this. This is actually a patient who presented to us at Duke Raleigh starting out looking like this, and we treated them and got this result from it.